Hey, we're back with part 4 of Triad Family Healing Center's Graciela Cruz and Dr. Ilya Skolnikoff. I'm Dr. Ilya Skolnikoff, this is Graciela Cruz. Graciela now has the green glasses on. The green glasses are really cool because they represent the heart chakra and anything surrounding the heart chakra, which is like the liver and the kidneys to some extent. Okay, so I know you'd think heart would be red, but it's actually green. And so now we're helping her with chemical challenges. So we diagnosed vaccination. So she was vaccinated at some point, and that seemed to cause trouble. And some of the things I'm doing are kind of like big things that just aren't good to talk about on video, so we're not going to talk about every little thing. But we're also having an infection in the colon that's maybe a little bit more than just a bacterial infection. In fact, we are finding viral as well. So we've got all these different things that we're doing. So we're going to go back. We just gave her some homeopathic remedies called vaccininum, 100 m and 1 m, so 2 different potencies. And then we're telling her to avoid mint for 3 days, so avoid mint for at least 3 days. We'll go back to the point for vaccines over here, or vaccinations. Go to another point for vaccinations here. This one's active. So we're going to see if we can help with that. We're going to help with it by eliminating it. So this is called elimination system, what I'm doing right now. Go figure. This is called regeneration system. Breathe, breathe. So we're helping her body regenerate after we eliminate the vaccination. The vaccinations are poisons and toxins. Sorry for having my back to you. I guess it's a little bit rude, but hey, at least we're giving you a nice free video. You don't have to pay any extra. You don't have to pay anything for that. Okay. So let's go back. Now she's going to a little healing from that. So we'll just let you breathe and hang out for 30 seconds or something. I guess when we hear that timer, that means you're going to be tired of listening to this. Okay, but this is really exciting stuff, so just pay attention. Your life and your health depend upon it, okay? So please pay attention to what we're doing. Okay, we'll recheck. We're done with that. So we'll go to vaccinations, then we'll go back to vaccinations here. So we're seeing, did I really help Graciela with her vaccination exposure throughout the course of her lifetime? And I may have and I may not have. So we'll check organs. There might be an organ I didn't help, and her body says there is. Is the organ above the clavicle or below the clavicle? Okay, so what is the organ? Is it related to fire, earth, or metal? So that could be related to the lungs, or it could be related to the colon still, or it could be that I'm making a mistake. Okay. This is descending colon and sigmoid colon. So we check ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, and sigmoid colon. Right lung, left lung, both lungs. Bronchi, 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 trachea. So I don't know, it just comes up bronchi, trachea. Go figure, okay? Bronchi, trachea. So our body's telling us something going on with the bronchi, trachea, meaning the throat more or less. So we're going to target in on that. So we're going to go DNA. So our whole body now knows what to do. If we just tell the DNA and the DNA system, and we help her, any degenerating tissues, to be aware of what we're doing, then we help to regenerate those tissues just really quickly, just like that. Almost like magic, almost like a magician, almost like some kind of voodoo, except this is the good kind of voodoo you always want to have somebody do with you, because you live longer, you're healthier, you're happier, you have better relationships, everything goes well. Okay, breathe in and out. Good. So remember, what are we doing right now? We're actually doing something very specific. We're helping with vaccinations that somehow are affecting Graciela's throat. And interestingly enough, the thyroid's in the throat, and you've had all these thyroid symptoms, right? All the emotions, she gets kind of congested here and all kinds of stuff. So, actually it's up here, but anyway, yeah. Okay. And your neck sometimes gets uncomfortable, I guess. Okay. Sometimes she'll have her neck be a little uncomfortable. I'm just looking at her file. Yeah, well, her shoulders, there's muscles in the neck that attach down to here, so. Okay, so we've got, we'll go back, bronchitrachea, bronchitrachea, bronchitrachea. Seems all right. So we'll go back here to check, are we done with the vaccinations? Organs, glands, teeth. So maybe we gotta help with her teeth for this particular toxin, which is called vaccinations. So we'll get a nice vial that says teeth on it. All teeth. Okay. And I know I'm not exactly dressed like a doctor here today, but you know, I really am one. And so I don't know if you can see this or if it's backwards, but it says teeth on here. So I don't know if that's viewable or not, but here, let me see. I think you can see that pretty well. Teeth. Okay, so that's the vial. And we've got other vials on her body, and so we're kind of doing a bunch of stuff. Okay, teeth. So we'll just tell our body about the teeth. Okay, so teeth only. We want to target in on the teeth only. We'll do the same thing. DNA system. Okay. Degenerate. You're okay? Okay, if you feel like you're passing out, that might be a sign that you want to let me know that you're feeling like that, or if you have to throw up or something. Okay. And then degeneration system, elbow straight here, regeneration system. So we're helping your body to regenerate, and the teeth have to do with infections. We're treating her for infections, both viral and bacterial, and then we're helping with the teeth. Sounds like a lot of great stuff. Okay. I'm pulling and resist. Okay. And we're just gonna relax a little. You have any trouble with your teeth? Are your teeth okay?
The gums in my like these.
Oh yeah, they're receding a little bit.
Are getting very low.
Okay. Some people brush their teeth a little too vigorously, or they use a toothbrush that's too firm. I don't know if you do that or not, but
I used to brush like all at once. So maybe that's where I hurt myself.
Yvette's starting to get really into how to brush her teeth. She was teaching me how to do it, so you can talk to her about that too. But yeah, so nutritional deficiencies will go with unhealthy gums also. So as if we're not doing enough already, we'll also go over with Graciela some kind of a diet she could follow, you know, something maybe that's doable. And, you know, we'll give her a little handout, right? We're not going to just do nothing about that. We want to, you know, help her, right? We got to help her out. So, and then we'll have her write down what she's eating from one meal to the next. We've got Standard Process of Northern California has given us these sheets where people can just write down what they're eating, and then we can go over it. It's like an accountability system. See how excited she is to look forward to writing down what she's eating every single day, all day long, in between everything that she's doing with the rest of her life. So these sheets are great. She just writes down what she's eating, and then we can see, is there something she's eating that's interfering with her health, right? Right char. Okay. What happened? You feel pain? Yeah, because you're holding it up for so long. Okay. Organ, gland, teeth, blood, brain, body fluid. Finish with the teeth. Okay, let's take these off. Okay, it'll help a lot if we get in the bra. You can walk around a little bit, but the bra is the wrong bra, so it's interfering with what we're trying to accomplish. Try walking around a little bit. It's okay. Don't be sorry. It's okay. Oh, no worries. So she's walking around. There's this. I'm not trying to get you ready. Try to walk like you're in a hurry, and I'll try to get out of your way. Actually, I'll just stay here. So there's an expression: the gait of man is the fate of man. So people, according to the Japanese, walk like use the whole room though. No, seriously, like you're in a hurry, like some kind of an athlete would walk. problem is, like I said, the bra is not helping right now.
Okay.
So they say the gait of man is the fate of the man. Fate of man. People walk around 1,000 steps a day or so, according to Isogai, the Japanese researcher. So if people have trouble with their gait, or they have trouble with their feet, or they have trouble with their knees, it can cause a lot of trouble for them. And so we're learning, we want to make sure that if we have done a great treatment for her, for Graciela, that it doesn't just all go to waste when she walks out of the office, right? When she walks out of the office. And it just so turns out that the bra she has is not the right bra for her, so it will interfere with the treatment. So we're going to end up, counseling her and giving suggestions on how to get a better bra and a different bra. Okay, thank you for coming to part 4 of Try to Help Family Healing Center's Dr. Ilya Skolnikoff and Graciela Cruz. Keep walking if you want.
Okay.
And maybe we'll see you at a part 5. Maybe it'll just be part 4 and that's it. Thank you.